Hello everybody, this is Dr. Kalpana Sringar from Prakruthi Charitable Foundation. Welcome to my channel, Tuning a Fragile Mind. Today I'm here to talk about drug addiction. Drug addiction is a very serious problem. Drugs affect the brain and the behavior of a person. So people these days are getting so used to taking drugs. Most of the teenagers, even adults, they continue taking it and they end up in rehabilitation centers. Addiction is a very serious problem. People who take drugs, very serious drugs like LSDs, cocaine, they could do so many crimes. And they are many a times they are arrested for different criminal acts. There are various types of drugs, cocaine, heroin, even alcohol addiction is also there, nicotine addiction is there. People get addicted to painkillers, opioids, morphine, LSD, and there are so many, cannabis, which is commonly called as ganja. People get addicted to all these very easily. They just start experimenting initially and then they get hooked onto it. They cannot stop taking it. And especially teenagers, they find it very difficult and they are answerable to their parents or elders at home and they do not know how to tell them. They start stealing. They take money, they go and give it to these peddlers, drug peddlers, and they take it from them and they start taking these drugs. And they end up with very serious problems. Any drug is bad. See, when a patient is admitted in a hospital for some sort of a serious surgery, he or she may be given painkillers. That does not mean to say that they have to continue taking it all their lives. Pain remains for a certain amount of time and it vanishes. But these people get so used to taking the painkiller and they continue taking it all their lives. And day by day it goes on increasing. They don't stop at it. They say, today I have taken one, tomorrow let me take two. If it doesn't work, take three. Some of them take injections. People get addicted to sleeping drugs like Compose, Valium. People get addicted to antidepressants like fluoxetine, Prozac, Flunat, and things like that. So these are all very serious things. These habits should be broken at the earliest stage possible. If these continue, they end up in hospitals. Many a times they require institutionalization also. I can tell you a very interesting case which came to us recently. He's a young boy, he must be around 16, 17, going to college. He's doing his engineering. He got into bad company and he started, stealing money and going out slowly at night, opening all the doors. He used to just slip away from his house and then give the money to those boys, older boys who used to wait near his house, and then in return they used to give him cannabis and he used to take it home and take it. The boy's behavior slowly started changing. He became aggressive, he became argumentative, he started dressing inappropriately, he was not in his true senses at times, and he never wanted to be in the same company of his old friends. He had got a bunch of new friends. It once happened where he just opened the tire of his car, his uncle's car, and he took the tire, and sold it. He got money and he bought some drugs. And he started taking it. And he got so habituated to taking it, he stopped studying, he stopped going to college. He stopped interacting with his parents. He comes from a very affluent family. He stopped talking to them. He stopped going out with them. He was only worried about when to take which drug. Day by day, it started increasing. Then one fine day, he was brought to us. He was brought to us in such a horrible state where he was not even conscious. He got up after about half an hour, and then when I asked him his name, he was unable to tell me his name. He could not even recognize his parents. You can imagine how much he would have consumed the previous night. So, of course, this boy was sent here for rehabilitation. He was treated here. And now he's all right. But we don't know when he's going to slip again. So this boy started off as a conduct disorder. By the age of 15, he was already a conduct disorder. He had started stealing. He started accumulating money and buying drugs. So when he becomes about 20-25, he's definitely going to grow into an antisocial personality disorder. He'll become very manipulative. As such, he's got into a habit of stealing and telling lies. Now, sir, don't you think these people need help? They have to be put in rehabilitation centers. They have to be given a lot of sessions of psychotherapy and behavior modification therapy, and see that you start breaking the habit. There's another case which I can tell you. He was a hardcore pethidine addict who was with us for quite some time. He started it because he was operated for some reason, and he started getting used to the injection. He continued taking it. You won't believe, there was not a small place where you could give an injection to him. His whole body was fibrosed. You try poking him, the medicine would just come out like a fountain. There was no way the medicine could go inside his body. He was a hardcore pethidine addict. Like this, we come across so many people who are addicted to morphine, who are addicted to compos, who are addicted to sleeping pills, who are addicted to anxiolytic drugs, antidepressants. So these people need to be treated. They can never be treated at home. They need admission. Initial stages, probably you can try, but it really doesn't work. You have to hide all your money. You have to keep everything safely. Do not keep any sharp instruments because they could harm themselves. They could harm others. They could attempt suicide. There are so many things that you can think of when you talk about drug addiction and a drug addict. So the normal way of identifying a drug addict is when you look at a person who has changed over the years, whose eyes are red, whose pupils are dilated, and who has got broken capillaries on his face and body, who cannot walk properly, who starts wobbling, who has slurring of speech, who forgets things, and who has tremors when he doesn't get the drug, when he's going through withdrawals. There are so many things with which you can identify that yes, this person is a drug addict. So try to grab these people and see that they, stop taking it. Try to break the habit. It is not easy even for the therapist to do it. It takes time, needs a lot of patience, because you are dealing with a conduct disorder or a drug addict who will not listen to you so easily, because he'll have that craving. If he doesn't take it, he goes through withdrawals. And today, if he takes an injection, tomorrow he may need 2, he may need 3, much later. So it depends on how much he wants and how far he is going to proceed. You have some other addicts who even go on smelling petrol. Some people, they're addicted to, this vanilla essence. They're addicted to that. When I was in Australia undergoing training there, We had a case who was addicted to vanilla essence addiction. And we were taken to the police station to help this person who was addicted to vanilla essence. And as the rule goes, you cannot touch a patient, you cannot force him to do anything, you cannot ask him to stop taking it. And we were sitting there, 5 of us. He just opened a bottle and he started guzzling what was there in the bottle. So everyone was scared. You could not say, don't take it. But of course, he was very clever. An antisocial personality disorder with a problem of drug addiction, he had diluted it. Because if you take concentrated essence, you could even die. And you will die. But this fellow had diluted it and he took it. And of course, he was all right. He was put into a rehabilitation center where he had to stay for about 6 months to somewhat get rid of his addiction. See, unless and until you feel that you want to give up something, you will not be able to give up. So where there's a will, there's a way. Unless and until you have a strong willpower, it becomes absolutely impossible for you to give up such addiction. So how do you identify that a person is a drug addict? Supposing you have a friend or a family member who is taking it, just keenly observe. See whether the person is talking to you properly, whether there's eye contact, whether he's dressed properly, whether he's slurring while he's talking, whether he's half drowsy and half awake, whether he's interacting with everybody at home and with his old friends. See whether he's complaining of any palpitation. See whether he's becoming more and more impulsive. See whether there's a change in his face, where his eyes are red, where his pupils are a bit stationary, dilated. So all these you should look for. Unless and until you're a good observer, you will not be able to identify that your child or your friend is having a problem of addiction. So when you come across such people, you have to immediately take them to the hospital. Let the medical professional see and assess the patient. Many a times they're advised to get them hospitalized because they may need detoxification. Medical detox is a must. You cannot do it at home. You cannot stop anything cold turkey. It becomes a problem. So medical detox is a must, where they're going to admit them and they'll give them drip, they'll give them some medicines, and there'll be people to talk to them. It may take about 4 or 5 days for them to show withdrawal symptoms, and withdrawal symptoms can be very, very severe at times. They could have fainting spells, they could throw seizures, they could behave erratically, they may not be in their true senses, they may become violent, they may become aggressive, they may become argumentative. There'll be a total behavioral change in most of the people who are going through withdrawals. So it is always better you hospitalize them for a few days to a few months. And the doctors know how to take care of them. And once they come out of their withdrawal, slowly they'll be sent for psychotherapy sessions, behavior modification therapy sessions, and then they'll see that the person becomes all right. The whole procedure may take about 2 to 3 months, because addiction is not so simple to give up. So when you come across such people, please take them to the hospital for treatment, and always be very careful with your teenagers at home. See that they don't drug themselves. See that they don't end up taking cough syrups. See that they don't take antidepressants. Everybody may feel sad once in a while. You don't need antidepressants for simple things like this. you should learn how to come out of it also. If you are so sensitive to everything, you'll end up with problems. Why are there so many cases of suicide? People attempt suicide because they are unable to, go through what they are going through. A simple problem may look very, very big to them. So they end up taking drugs to forget all this. And what happens finally? They end up in hospitals. So viewers, see that your children don't end up with these problems. There are so many people who are drug peddlers. They give them drugs. And always see that your money is safe at home and your children don't steal this and give it to these people to get drugs in return to the money that they have given. So you have to be very careful in observing your children. Especially teenagers get into all sorts of bad habits very, very easily. They start experimenting on everything and anything. For them to remain awake the whole night, they start taking amphetamines, which is also dangerous. Just before the exam, they want to sit and study the whole night. So they consume all this and sit down. All these things in the long run will show a lot of problems in the entire system. A human body is like a machine. So if there is a problem in any part of the body, the entire body suffers. So see that your friends and your children don't end up having these problems. I'll talk about alcoholism in the next video. Alcohol addiction, nicotine addiction, mobile addiction, these are all very, very serious things. So please watch the other videos that we are going to show in the future, and thank you very much for your viewing.